Instagram, what's going on? It's Coach Erin here, and hope you're having a great hump day morning. I just wanted to bring to you your Get Up and Move live today, and today is actually going to be a little bit more about mobility. So I'm going to give you one exercise to do, so still set your hourly timers. You're going to do this exercise, 10 of them, but first, before you do those exercises, I want you to do two more things. All right, we're going to give you a little bit of a stretch and a bit of a mobility exercise for your ankles and the lower legs. So try this, especially if you struggle with any kind of ankle mobility issues or not being able to get deeper into your squats. Some of that, of course, is how your body is proportioned. So you may want to look into that if you're looking to get deeper into your squats and you're not sure if you're doing it properly. Then definitely look it up, talk to a professional, definitely reach out. I'm happy to discuss and help you out and come up with some strategies to help you get a little bit deeper into that squat. Or maybe it's just your body's just not made to go deeper, and that's okay too. All right, you can always work on that strength instead, okay, or explosive power or anything else. Okie dokie. So first things first, ankle mobility. So we're talking like here, if you tend to get down a little bit lower into your squats, or say here, and you feel like you can't without bringing your heels up off the ground, or you can't put your heels onto the floor when you're down in, say, like a yoga squat like this. All right, so what we can do here is there's a few things that you can do to modify, but first and foremost, I'm gonna go through a quick series here. You have to have the trifecta in terms of mobility. So you want a soft tissue tone, can be something that's affecting your depth in your squat and your ankle mobility. It can be bone, so it can be structural, depending, especially if you've had any ankle injuries or bone spurs, anything like that, that's kind of constricting that movement. So those are very different things, and you would do very different things with that. So if you are struggling with it, again, maybe chat with a professional so you can figure out exactly what's going on and find ways to help improve, to prevent injury, or to decrease pain or relieve pain if you're dealing with any pain through the movements, okay? So first and foremost, let's say I just want you to, we're gonna go into something called tibialis posterior, which there's tib ant and there's tib post, which is just sitting behind your tibia. So it's kind of a deeper muscle. There's lots of different layers in there. So if you can cross your ankle, or even if you're sitting on a chair or anything, bring that ankle up across the knee. So your tibialis, or tibia, sorry, is this long bone here on the inside, not the outside, the inside of your leg. So you can feel that bone, you find that bone, follow it down, and you can just say somewhere mid calf, basically, or mid lower leg. You kind of take your thumbs, okay, place them parallel to the bone, and then slide them off and just under. So the muscle of the tib post is quite deep, okay? And you may have to get a little bit deeper in there. Anything is really gonna help, to be honest, but so you find an area that's a little bit tight. So right here, this is quite sore for me. And so I'm just going to place my hand over that thumb, okay, because I don't want to really use the thumbs too much. You can get sore thumbs if you're doing that too much, especially if you're in massage therapy. So I'm just going to place the palm over, and I'm going to help put some pressure onto that spot. While I'm doing that, I'm just going to maybe do that all along the length of the tibia, right? Just to release any soft tissue maybe that's holding on, all right? So all the way down to your ankle bone, big bone that sticks out there, right? Okay, so just digging in there. Okay, nice and slow and gentle, helping release that soft tissue. Okay, so once you're kind of doing that a few times up and down the leg, you place your thumb again parallel, press that palm in on that sore spot. Sorry, I'm jumping around a little bit. And then what you can do is you're going to point those toes and then pull the pull the toes back, okay? Holding that pressure and that tension, just nice and slow, back and forth with the toe flexion and extension, okay? All right, so once you're done that, you can spend, you don't have to spend too much time on this, maybe like a minute for that whole series, okay? that. All right, and then what you can do as well is sometimes if there's soft tissue tension, you can do another stretch, and I'll show you 2 stretches for the lower leg that may be helpful. Well, actually, 1 stretch that may be helpful for your mobility in the lower leg. So we often look at the gastrocnemius, or our calf muscle, as one muscle that's contributing to that bottom lower leg, or sorry, the lower leg musculature. So what that gastrocnemius is, that beautiful muscle that pops out, all right? Kind of that heart-shaped, upside-down heart-shaped muscle that you see, especially ladies that wear high heels, looking good, right? So that is your gastrocs, but your gastrocs is really about when you have your legs straight, so knees are not bending. As soon as you start to bend your knees, the muscle that's actually involved in this movement is called your soleus. So the soleus goes underneath your gastroc muscle, and it kind of comes a little bit lower. So your gastrocs are up higher, especially if you're a man, it's gonna be way up here. Your soleus is this part of the leg. This is where you're gonna probably notice it a little bit more. So to get into that one, what you want to do is you can use a wall or a chair or nothing at all, but for a little bit of support. So gastrocs, you normally see us going like here. You think, oh yeah, I'm stretching my calf muscles. And you are, but you're only getting into one of them. So what you can do there is take that foot back instead from the wall. Both are good to stretch, of course. So you're going to take a step back. And instead, now what I'm going to do is I'm going to keep my heel planted on that back foot, and I'm going to bend the knee. All right, and now what I'm feeling is a stretch through that lower part of the lower leg, and that means that I'm getting into the soleus, which is responsible for that ankle mobility when your knee is bent. All right, so you're just gonna hang out there for a little bit, make sure that the toes are pointing forward, and yeah, hang out. You can do maybe holding it for maybe 15 seconds maximum, okay? I'd say even more like 5 before you do your exercises, because we want to keep it dynamic. So holding it for 5, you can come on out for a second. All right, go back in. Hey, come on back out, straighten that leg, and then back in. So do 8 to 10 repetitions of that. And then I'm going to give you one more for a specific ankle mobility, okay? And I'm going to use this hip band. So what I'm going to do here is I'll focus still on this ankle. So I'm going to put it around my just above my knees here to start. And then what I'm going to do is I'm going to take one leg forward, so the ankle that you want to do the work on mobility on. Okay, and then I'm going to pull just kind of creep my foot forward until there's quite a bit of tension, all right, in the band. So you can use an anchor point as well if you're in the gym. You can just tie one of the loop bands, make sure it's a fairly high tension, and you're here. So starting in like a low lunge position, your hips, shoulders, everything are facing forward, toes, knees, everything. Okay, so from here, all you're gonna do is you're going to let that knee come forward. So you're gonna bend forward, keeping some tension through the glutes and the hips and through your core, because you also just don't wanna, because as soon as you lose that tension, your hips kind of tend to shift, and that's not what we're focusing on here, okay? We want to stay nice neutral alignment, squeeze the glutes, come on forward, okay? And if you want some help with that, you can have your chair or anything in front to help support, pulling that knee forward, and come on back. So again, you're doing about 8 to 10 repetitions, holding about 2 to 3 seconds, and you want that band right around the front of the ankle, okay? And that should also help with a little bit of mobility. Okay, so after you've done those, then you're gonna go into your squat. So you've done that on both sides, 8 to 10. This whole thing should take maybe 5 minutes every hour. So do your best to get those movements in, okay? And then we're gonna do 10 squats. All right, so shoulder width apart with the feet, toes are pointed slightly, about a 35-degree angle. Hey, chest is up, hey, glutes are squeezing, shoulders are back, core is nice and tight, and we're going to let our bum drop back and down while we bend at the hips, and at the knee joint. Okay, when we're doing that, we want to think about putting an outward, a lateral rotation or external rotation through our legs, and that's going to help keep everything through your hips and everything supported, and your knees pressing out a little bit wider. Okay, so I'll show you from the side. Okay, we're going to come down. I've still got that outward tension. My glutes are squeezing. Everything is working here. I'm going to get as low as I possibly can. I can get nice and low. My heels stay on the floor. That's okay. If your heels want to come up, just go to where that happens. Squeeze your glutes. Come on up. Okay, one thing that may also help is putting something under the heels, maybe about an inch thick. This might be a little bit high, but that's okay. All right, and same thing applies. I'm gonna come on down. Glutes are squeezing, knees are pressing out, right? And the main thing that we wanna try to keep in mind is that the angle of the lower leg and the angle of your torso are staying the same. They're parallel throughout the movement. All right, here and up. Okie dokie. And then showing you from forward. Okay, one time, you're doing 10 of these total, and I'm very, very confident and comfortable that doing those mobility exercises before you do your squats is really gonna help, and you're gonna get the most out of your squats. You're gonna improve your form, be able to take on a little bit more weight as that mobility improves. So guys, if you have any questions, let me know. If you want more of this, I have my 30-day lower body program starting soon, October 25th, okay? And in that, I'm giving you 5 workouts a week, all right? 3 are focused specifically on the lower body, all right? 2 are specifically focused on more high intensity and full body, working the upper body and core, all right? And I'm also, because I'm really big on mobility and stretching, I have a 30-minute full body stretch routine that you can do any day of the week, but especially on those active rest days. I also, the boys are going crazy upstairs, I hurry up. I also will include 2 lower body mobility videos, and I do the same for my 30-day upper body video program, and a couple of core burners. So really want to get that still, although it's focused on the lower body, it's really a full body program, and I go more in depth because I really want you guys to stay healthy, prevent injuries, and all that good stuff. So if you're interested in that lower body program, let me know. And yeah, let's get started October 25th. Super stoked about that. Send me a DM, and you guys have a wonderful day. I better go because the boys are fighting, and take care, guys.